So this last section for this week's lectures is going to talk about skin cancer and burns. Most skin tumors are benign, which means that they don't metastasize or spread to other parts of the body. Risk factors for cancer include overexposure to UV radiation. So in the beginning of this, I talked about what UV does to your DNA. And then also frequent irritation of the skin. Anytime that you have an increased need for mitosis or an increase in cell division, the more times those cells divide, the greater the chances that a mutation is going to happen, and those mutations can lead to cancer. Some skin lotions contain enzymes and liposomes that can fix damaged DNA, and they tend to put those in sunscreens and such. So starting with the different types of skin cancers, we have basal cell carcinoma. So basal cell carcinoma starts in the stratum basale cells, and they proliferate and slowly invade the dermis and hypodermis, so they grow all the way down, and then they're going to protrude out and create this pimple-like structure. And here they show it on the nose, but it can appear in any place on the body. It's cured by surgical excision in 99% of cases, and doesn't require other treatments like chemotherapy or radiation or anything like that. These are the most common and less likely or least likely to metastasize. A squamous cell carcinoma involves the keratinocytes of the stratum spinosum. It's most common on the scalp, ears, lower lip, and hands, and it has a good prognosis if treated by radiation therapy or removed surgically. A friend of mine developed this, and this is what it looks like, and sometimes this one can be sneaky because it can hide underneath your hair. So all you feel is this rough patch, and then if someone else looks at it, usually it has multiple colors in there, so you'll see some bleeding. Sometimes it can increase in size and decrease in size. And like I was saying, a friend of mine had this. She had this region on her cheek that would change color and grow and shrink, and she finally went to the doctor and she tested positive for squamous cell carcinoma. When they removed it, they had to take chunks of her flesh all the way through her cheek, and the recovery from that was really long. Today, you never know that she even had it. A melanoma is the most serious. This involves melanocytes, which are going to produce pigment. So cancer in pigment-producing cells is going to cause it to change color. This is highly metastatic and resistant to chemotherapy. So it's treated by immunotherapy, which even that has shown to be not successful. From the time of diagnosis to the time of death, it can be as quick as 3 months, depending on when the diagnosis is made. So my friend's mom recently passed away of melanoma, and all she had was this little mole-like spot on her back. And the mole got a little bit bigger and grew, and it had some weird borders to it, so she decided to go get it looked at. By the time she went to the doctor, the cancer had already spread to several lesions in her brain, in her lungs, and in a region in her abdomen. So it was too advanced for them to adequately treat her, and she ended up passing away of melanoma. Melanomas are extremely dangerous. The characteristics follow the ABCD rule. So the ABCD rule is used to diagnose a melanoma. The A is for asymmetry. The two sides of the pigmented area do not match. B is for border. The border exhibits indentations. C is for color. The color should be black, brown, tan, and sometimes red or blue, so it should have some type of color. And D, diameter. The diameter is larger than 6 millimeters, or the size of a pencil eraser. Another person in my life that had this is my uncle. My uncle, who lived in Arizona. He was always outside doing gardening and going for hikes and everything, and he ended up developing a melanoma on his arm. Now I'll talk about the treatment of that. I thought I had another slide, excuse me, that went through more in depth about the treatment. But treatment for my uncle, it was in the middle of his arm. They ended up cutting him open from his wrist all the way up to his axillary region. And what they did was investigate all of the regional lymph nodes to see if this had spread. So he had an incision. Basically, his entire arm was cut open. And when they took out those lymph nodes, they discovered that it had not spread to the lymph nodes. So he was lucky. They caught it early enough, and it didn't metastasize. But he was in an area where melanomas are pretty common, so the doctors are all over it. They always diagnose that right away. Unlike if a person up in Wisconsin were to get a melanoma, that may not be the first thing that comes to mind for most doctors here. All right, and then we talk about burns. So burns can be caused by heat, electricity, radiation, and certain chemicals. A burn is tissue damage that involves denatured proteins and cell death. The immediate threat with burn victims is dehydration and electrolyte imbalance, which can lead to renal shutdown and circulatory shock. Renal is talking about kidneys. So the number one cause of death in burn victims is kidney failure, which seems kind of crazy. A lot of people think that it's infection that would be the biggest concern, but really you got to maintain that fluid and electrolyte balance because it will shut down the kidneys. So the rule of nines is used in order to calculate a relative amount of fluid loss based on the amount of burns and the severity of the burns. So they divide the body into certain percentages, and then they calculate like how much of that area was affected by a burn and what type of burn, and they put this all together in order to calculate the amount of fluid loss due to that particular burn. So the rule of nines is used to calculate fluid loss associated with burns. The types of burns, we start with first and second degree burns. First degree burns involve the epidermis only. That's going to cause redness. When you go get sunburn, that's an inflammatory reaction. Sunburn, however, can lead to a first degree burn, and a burn has to do with how quickly this reaction happens. If you get exposed to really hot sun and you're out there long enough where it turns red almost instantly before you even go lay down or go in the house, then that would be a first degree burn. If you go lay out in the sun and then everything seems fine, and then you go in the house and hours later you end up developing sunburn, that is an inflammatory reaction, and that inflammation will go away. Second degree burns involve the epidermis and the dermis. In a second degree burn, blisters arise. And then a third degree burn is also called a full thickness burn. It involves the entire thickness of the skin all the way through the subcutaneous layer. It's gray to white, cherry red, or black in color. There is no initial swelling or pain because the nerve endings are destroyed completely. The problem is it's usually not like a cookie cutter edge to where there's a third degree burn and a second degree burn. So usually it goes from second degree down to third degree and then back up to second degree and then up to first degree. So usually it's like a dip down. So if you get a third degree burn, likely there's also second degree and first degree burns in the area, so it will be painful. This is just saying that because the nerve endings are destroyed in that particular area will not sense pain immediately. Skin grafting is usually necessary, and now they have this amazing mesh material where they can put stem cells on there and regrow your tissue with very low likelihood of rejection. Burns are critical if more than 25% of the body has second degree burns, if more than 10% of the body has third degree burns, and if the face, hands, or feet bear third degree burns at all. Why the face, hands, or feet? Well, those are the areas that filter a lot of blood or have a lot of fluid accumulating. So think about how we determine how severe a burn is. It's how much fluid you're losing. So if you have a lot of fluid in the face, hands, and feet, and you have third degree burns there, likely you're going to have a very high fluid loss.